Good morning, my name is Alma Palacios and I am recording this video for Nursing 4502, Nursing Leadership and Management. The purpose of this video is to analyze, I provided a SWOT analysis on the gaps in care in my facility. I work at Texas Tech GYN Oncology Clinic, Obstetrics and Gynecology. And what I discovered upon writing this paper is that it's such a large facility that there's 4 clinics actually in one area. There's regular OB/GYN oncology, there's OB/GYN oncology, sonograms, regular OB/GYN, and then urology. The clinic sees over 300 patients a day. It is staffed by faculty, which are the regular doctors, residents, RNs, LVNs, and certified medical assistants. And then on the side, we have the clerical staff, which register patients and provide any supportive clerical needs. So then I found that because it's such a large facility and we're understaffed, right now they're in the process of hiring a nurse manager, 2 RNs, and then 2 LVNs and 4 medical assistants to see if it'll lessen the burden, because we get so overwhelmed by seeing so many patients. We don't have enough staff to attend to them. So then our gaps in care there are that we don't do proper hand hygiene, and sometimes we lax on the patient identifiers because we're in such a hurry to get the patients inside, and we don't want to fall farther behind, and we just bypass all that. But the initiatives that we have to make sure that we do are good hand hygiene, and then that we correct the correct patient, correct site, and correct procedure. That's what we need to do. So we need to be diligent in doing that. And then what evidence was used to collect this data and that we needed to do this SWOT analysis was that administration, supervisors, nursing, and residents, they all meet together. Then they discuss the gaps that we are having in the care provided in the clinic. And then from there, we take corrective action. What goal are we trying to meet with this analysis is that in order to be JCAHO compliant, we have to be at least at 80% compliant with all our hand hygiene initiatives and two patient identifiers to be accredited by JCAHO. Any of you are accredited by JCAHO, of course, everybody knows that you're providing excellent patient care. What national standards are being met by addressing the initiative is the 2007 JCAHO standards, and they're posted throughout the clinic, so everybody is made aware and reminded about the hand hygiene and using the 2 patient identifiers. Who collects the data and how do they compare to other data? Supervisors, RNs, the manager, we all collect data, and then it gets presented to the administrator, who then presents it to the Council of Consuls. They meet on a quarterly basis. Then the administrator will get back to us, we'll have a meeting, and let us know if we're going to implement any changes. What agencies does all this information get presented to? JCAHO, so that we can get accredited. Center for Disease Control, because besides also seeing regular obstetrics and gynecology patients and oncology, we also see people that come in to test for STDs, and so then we need to report to them. And then of course Texas Tech describes how are we involved in helping with the initiative. Well, we work to get together closely with the medical students and faculty, and we let them know how to correctly document and correctly how to do the procedures so that we're compliant. And then other multidisciplinary staff that we get involved are the doctors, the residents, and midwives. They also have their own separate meetings and discuss the type of services that we're providing, and if we're being compliant, if we're missing on any other steps or procedures, and then we take correction from there again. And who determines the timeliness of the implementation of any initiative? It's usually administration and the Council of Councils. They meet quarterly, and then they decide what changes we're going to go through. What are some of the challenges that we have in providing these changes is that the patient timeliness. Normally they run over 30 minutes behind, so then the clinic gets backed up. And then again, since we're short staffed, then we're running, trying to make sure that all the patients get seen, vital, and it just causes a lot of congestion in the clinic. How can we address these challenges? Well, we need to teach our patients, to be on time. Also, our faculty about the scheduling of patients, so it'll make it better in the clinic, and we don't have so much congestion causing us to bypass correct procedures and how we do them. What progress would a nurse need to go through to make changes in the workplace? Well, when we meet, before we even implement or present the case to the administration, we need to come up with a solution. And then after we have a solution to our problems, then we present it to administration, who will then go to the Council of Councils for changes. How do we get other departments involved in this? We have monthly staff meetings where changes are introduced. We have an open table. We discuss all our issues, and hopefully that's how everybody gets involved. And what do I want to accomplish with all this? That we have appropriate staffing to provide good quality, safe patient care. And our budget, only the administrator knows that. We hardly hear anything about our budgeting. It's kept very quiet. So budgeting I couldn't address to. Thank you so much. Have a good day.